We're here this afternoon with Dr. Kurt Avery at Stonebridge Medical Veterinary Hospital, emergency room, clinic, the whole 9 yards. Last time we did the video on part 1 of the canine dental, and today we are going to go into part 2 with a little more of the technical background of what we do with our canines after we bring them into the clinic and we turn them over to you. What takes place after they come in and they get checked in and they're ready for their dental cleaning?
Yeah, absolutely. And there's a lot that goes on for us. We take dentistry very seriously, and something that what it should be, and the way that we feel is that dentistry should be a lengthy process. It's not something where they just come in and they're under anesthesia for 20 minutes and then we scale their teeth and wake them up. It's actually far more involved than that, and the reason for that is that when you're looking for problems in the mouth, that's the best chance that we have for helping these guys long term. And I often tell clients there's really two things that I can do to really help with the longevity of our patients. One of those is weight management, just staying on top of weight issues. The other is absolutely staying on top of their dental concerns, their dental issues. And so with that, the opportunity that we have to work with them while they're under anesthesia is really critical. That all starts with an IV catheter and basically starting with fluid therapy. We really don't do much in the way of anesthesia without putting an IV catheter in and starting there. And of course the testing, the pre-anesthetic testing and things that we do, the exam and things to make sure that at least that we're the problems that can be avoided by predictable blood work results, that those things have been identified. As far as the process, of course, we give dogs a pre-medication to help them to feel comfortable while they're being induced under anesthesia. And then one of the critical things, and a lot of times people will ask a question, well, why does my dog need to be under general anesthesia?
Right.
And there's a couple really good reasons for that. One is that induction part of the anesthetic event is one where we do pass a tube down their throat, and it sounds, some people kind of get concerned about that. It's actually a great thing. It ensures that we have a proper airway through the entire procedure. But here's the thing, dentistry is a very disgusting part of medicine, okay? At least in my opinion, no offense to the dentists out there. It's not something we ever consider doing anywhere near the surgical suite, something we do out in our treatment area that's specifically designed for dentistry. And in doing that, there's at the end of that tube that I was talking about, there's a cuff that once that cuff is inflated, it actually keeps the bacteria and debris from actually going down into the lungs where clearly they don't. It doesn't belong. And the goal there, of course, is to prevent infection, pneumonia, and those types of things that are secondary to bacteria getting down in the lungs. That's a critical thing. Of course, there's a lot of water involved, while keeping all that water and things, inside the mouth as well. The other thing for us, and this is not everybody takes dental x-rays, and we're going to talk about those in a minute, but for us, the digital dental probe that we use is about $5,000. I don't really like the idea of dogs chomping down on that in the middle of the procedure, so it's really a side note as to why we like that them to be completely under. Probably the most, well, I think that the cuff inflation is the most important, but maybe another key factor is the fact that we use an ultrasonic scaler, because most of the time they don't just need a little bit of hand scraping like we do. The fact that they develop so much tartar in between the
heavy layers.
Yeah, and we have to use the ultrasonic scaler and essentially using sound waves to break up the tartar that's on the teeth. Dogs and most people would have problems tolerating that, and of course that's why general anesthesia is critical. To kind of take it one step further and identify the different aspects of what's involved with dentistry, and obviously this is it's a lot to explain, but it is important. And to kind of follow up with those x-rays, we personally take a set of digital x-rays, and we've got a standard of care in that every dog and every tooth that we do a dental on, we essentially take an x-ray of every tooth. The reason for that is that even in the young dogs, even in older dogs with teeth that look wonderful, we at times will, and in fact unfortunately more often than what we would hope, we do find pathology, we find problems. We find fractures, teeth that are fractured that have predisposed that tooth to an abscess. We find abscesses around teeth that didn't look like they even had anything externally, wrong with them on the crown. We certainly find cavities and things, although they're less common in the dogs. They're certainly possible, but those dental x-rays are critical to identifying that pathology, because there's plenty of times that you have a tooth that looks good on the surface, on the crown,
right,
is not mobile, and you take an x-ray and certainly you find this, what they call a periapical abscess around the base of that tooth, around the root of that tooth. That is interesting, because that is it's one of the most rewarding parts of my job, because oftentimes when I identify that problem and deal with it, that's a tooth that's a dog that's going to be feeling a lot more comfortable after
right.
the procedure.
That's right. And eat better.
And eat better. And incidentally, they don't typically, paw out their face or act like they've got a problem.
They can't tell you.
They don't. And I asked the dentist one time, and he said, well, it's part of their innate kind of instinctual responsibility, but so much survival that goes in with their mouth, they're not going to show a lot of pain associated with their mouth. But for me, it's how they act after the procedure that really lets me know that we're getting somewhere. That
Sure.
we actually, help this patient to improve their quality of life.
Sure.
So anyway, dental x-rays are important, and for us, we use a digital set. The other things, of course, the scaling and polishing that's been included in dentistry for years, those things are obviously part of dentistry. But the other thing from an examination standpoint is a probing exam. We use a dental probe, just like we use in human medicine or human dentistry, to identify the individual pockets in and around those teeth.
And how deep they are.
The depth of those pockets, and we document that, and we compare that to previous dental visits. And what that does is, allows us to know, one, to obviously define some of those abscesses, even if they're not, clear cut on the X-ray. But two, if it needs something like open root planing, where we should make an incision into the gum and get all that debris out of there and remove that and then close the gum back down, that's something that's possible. There's also adhesive antibiotic materials that can be placed underneath the gum to try to decrease that pocket. So there's a lot of treatment type things that can be done once you identify the problems.
Right.
And I bring all that up in kind of a wordy fashion only because the way we used to do dentistry is very different than the way we do dentistry now. The x-rays, the diagnostics, the exam. In fact, as a technician, as a young person, teenager, doing dentals for practices that I worked at, scrape the teeth and then wake them up. It's what we did.
Pretty basic stuff.
And for us now, I don't know that we necessarily would have gotten this far if we hadn't had the diagnostics. So all those things together, and of course the fluoride treatment and some of the other things, that's what makes up a typical dentistry. And for us, recovering them from anesthesia, same way we would for any patient. That's of course having somebody monitor, stay with those patients until they recover.
Excellent. This has been really educational, and I appreciate Dr. Avery explaining this to us. And you also have an injection that you give after cleaning. Is it the...
There's a dental vaccine that often we like to use, especially in the little dogs. If I could, I'd get every little dog into practice a dental vaccine. The goal there is actually to help the body to mount an immune response to those bacteria that are most likely to cause periodontal disease. Yes, it's not necessarily labeled for tartar accumulation in the mouth, but what it is the periodontal area is basically all the supporting structures of the tooth. The root, the gums, and everything above, basically that you don't see. And so the bacteria that typically cause those problems, this vaccine is geared to help the body to recognize them. And we're actually seeing some really good results. I was a little hesitant when it first came out, but now that some time has unfolded and we've seen some of the good results, we've been more inclined to use it. And now, I feel very strongly that it's something we should use a lot of. So
good, very good. All right, thank you for having us today, and we enjoyed that. Again, we're here at the Stonebridge Veterinary Hospital at Rockwall, Texas. Thank you.